This article from Dr. Landford's group details some of the dangers pregnant surgeons face. Hospitals and operating rooms contain chemicals that can affect people and particularly unborn babies. Pregnant surgeons should always wear gloves, face shields, and N95 masks. Pregnant surgeons should avoid iodine-containing scrub soap, which can elevate iodine levels and that can hurt the baby. Another dangerous chemical is what is known as surgical plume. In the operating room, lasers and cautery machines remove tissue and control bleeding. However, these machines create smoke. I was surprised to learn that standard OR masks filter out only 23% of surgical plume particles. Surgical plume inhalation increases the risk of stillbirth, premature birth, and nervous system deformities. Inhaling the smoke plume from just 1 gram of tissue is equivalent to smoking 3 to 6 unfiltered cigarettes. Nasty. N95 masks and smoke suctioning reduce the risk. Radiation exposure can cause skin rashes, cataracts, and an increased risk of cancer. Fetal radiation exposure can result in birth defects and early childhood cancer. The pregnant surgeon should minimize radiation exposure by wearing a lead apron with a special fetal apron that provides extra protection to the baby. Being a surgeon requires prolonged standing, awkward lifting and reaching, long work hours, and limited rest. Pregnant surgeons should avoid long surgeries, try to be as ergonomic as possible, and avoid falling. Operating room noise is also a hazard. High noise exposure can result in ringing of the ears and long-term hearing loss. Noise increases stress levels, which can result in low birth weight, prematurity, spontaneous abortion, and growth retardation in the fetus. Keeping the noise to a dull roar is critical. Surgeons can be exposed to HIV and hepatitis when they suffer needle sticks or from surface contamination in the OR. In the hospital, there's the risk of nosocomial infection. When sick people cough or sneeze, bacteria or viruses can be thrown out into the air for others to breathe in. These infectious agents may make a pregnant woman sick, and they can also cross the placenta to cause a birth defect or a miscarriage. Gloves, masks, and social distancing prevent infection. Dr. Landford's article contains specific recommendations to incorporate during pregnancy to avoid exposure to chemicals, smoke, radiation, noise, and infection. This is important advice for every pregnant woman.